Does your doctor listen to what you have to say? I mean, really listen? Do you get the time that you need to tell your healthcare provider what's really going on with your health, with your symptoms, with your life? I want to talk today about healthcare communication. I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy to understand patient education resources. And most of those are about optimal hormones. This video has a lot to do with patient education, even though it's a little bit less hormone specific. By the end of the video, though, you'll see the relevance of this topic to those of us, both men and women, who are seeking to have our hormones optimized. Well, how much time do you get with your healthcare provider? Maybe your primary care provider or your family doctor? Some studies say the typical primary care visit is around 15 to 20 minutes, give or take. In that time, supposedly about 5 minutes is spent with the patient actually doing the talking, 5 more where the doctor's doing the talking. Our modern, mostly insurance-based healthcare system sort of incentivizes short office visits. There's really no financial incentive for healthcare providers to spend more time with their patients. Of course, many providers, they want to spend more time with patients, and some of them actually find a way to do just that. Providers recognize that spending quality time with their patients is probably the most satisfying part of their jobs, and they do say so in surveys. But that doesn't change the fact that the healthcare system in this country pushes doctors towards shorter and shorter office visits, towards seeing 20, maybe 25 patients, maybe even more every single day in their practices. It's not really the provider's fault. If we think about a physician, they typically work a 10-hour workday. That's not uncommon at all. That physician might be required to see 25 patients, as I mentioned, during the course of that day. If you just do simple calculations, you find that 10 hours minus maybe they get a 30-minute lunch break. So 9.5 hours is about 570 minutes. Divide 570 by 25 patients, and that's 22.8 minutes per patient. That doesn't sound too bad on the surface, except that implies that the physician is spending every single second of those 9.5 hours actually with patients, which doesn't really happen. So one study showed that maybe 27% of providers' time was in direct patient interaction. 49% was used up with computer work, administrative work, electronic health record entry. There's also data that shows healthcare providers commonly spend 10 to 20 hours every single week doing insurance busy work. So let's just say on average almost 3 hours or 180 minutes out of every day. Might even be closer to 4 hours a day. And if you don't even include time to walk between exam rooms or talk with nurses or staff, the average time spent with patients has now gone to a little more than 15 minutes per patient. I said earlier that research has shown that patients talk for maybe 5 minutes out of that time, that 15-minute office visit. Does that 5 minutes, maybe a little bit more, with a healthcare provider even allow time to explain the reason you made an appointment in the first place? Does your doctor have the time or even the focus and attention to really get what you're saying, to really sort of connect with you on some human level, some person-to-person level? I've been doing some reading lately about patient-centered healthcare. This is a concept that's sort of foreign to our healthcare system, at least in the US, and I pretty much suspect it's the same in the UK, in Canada, Australia, and a lot of other developed countries. The emphasis in healthcare over the past 50 plus years has been volume. We're trying to crank those patients through as fast as we can, get them in and out, and don't spend too much time with each individual patient. Well, unfortunately, there's also a lot of research that shows spending more time with each patient, slowing down and actually listening to what that patient has to say, with their words, with their body language, with their eyes, actually connecting with those patients on a human level. Those things have shown profoundly positive effects on the outcomes, meaning the results of healthcare. Physicians who are enabled to spend more time and to connect more deeply with each individual patient find that those patients respond more positively to making, say, lifestyle changes or dietary changes. They're more likely to use medications correctly, more likely to follow their provider's recommendations. Slowing down and listening more closely makes a huge difference in the experience for the patient and the provider. It becomes a much more satisfying interaction all around for everyone involved. Even just a slightly longer office visit might feel a bit less rushed and a bit more relaxed. The patient won't see the doctor sort of looking at their watch and putting their hand on the door, making their move to get to the next exam as fast as possible. The provider's not going to feel the need to rush through the office visit, staring at their computer screen and typing notes, instead of connecting with the reason for the visit in the first place, which is the patient. Well, there's an amazing TED Talk with Dr. Abraham Verghese. He's a cardiologist at Stanford who also happens to be the best-selling novelist who wrote Cutting for Stone, one of my wife's favorite books of all time. Dr. Verghese is a big proponent of empathy in medical practice. At the end of this video, I'll post a link to a YouTube playlist that includes Dr. Verghese's TED Talk, along with a couple of videos where Dr. Verghese talks about the importance of empathy. He also talks about connection and patient communication. In another video on being a doctor and connecting with patients, Dr. Verghese identifies 5 evidence-based practices that physicians can incorporate in interactions with their patients. He talks about using a mental checklist to maximize that patient-physician encounter. It starts out by preparing with intention before even entering the exam room, listening intently and completely, agreeing on what matters most to both the patient and the physician, connecting with the patient's story, and exploring emotional cues that may or may not be spoken out loud. Well, if you're frustrated with the time and attention that you get from healthcare providers, if you felt maybe unseen and unheard by a healthcare practitioner, especially maybe when it comes to hormone issues that your provider may not listen very closely about. One example is menopause. I've heard lots of women in menopause who tell me about experiencing a provider sort of brushing off their concerns. You'll just have to wait out menopause. Or maybe thyroid. Has a provider ever dismissed your concerns saying, well, your thyroid levels are normal, we can't really do anything for you? Or maybe low testosterone for men. You're just getting a little older, here's a little blue pill, try that and see if it makes any difference. Or here's a terrible one from my perspective. I'm so sorry, it looks like your family member has Alzheimer's disease. There's really nothing that can be done that makes any difference. You can try one of these laughably ineffective medications. Well, if you've been on the receiving end of less than patient-focused healthcare, I'd encourage you to look for a healthcare provider who is willing to spend the time and the attention necessary to get down to the real issues. Look for a provider who cares less about what your insurance is paying, who watches the clock less, and who cares more about you as a person and helping you either maintain or obtain your health and wellness. If this video has been helpful at all, click the like and subscribe buttons to get notified anytime I post a new one. Thanks so much for watching, and I'll look forward to talking to you again soon.